Hi, my name is Dr. Bryant, and today we'll be talking about implant parts, organization, and inventory. There are certain implant parts that we do not throw away. That way it'll help save us on cost, and then that way we have the right materials when we need them. It all starts with the doctors, and then it helps if you get your main dental assistant involved. Here we have our surgical kit. The doctors are responsible on putting the drills back in the same order. I recommend once you're done using that drill, place it back in the same spot where you found them. Do not rely on your dental assistant. The kits are then placed in the clear bags, then that way you could easily identify them in the future. Implants come pre-mounted, and these mounts can be tossed away afterwards. Implant parts that need to be sterilized and organized are healing abutments, impression copings, and lab analogs. They're first ultrasonicked, bagged and labeled, sterilized, and organized. The doctors are responsible on labeling the brand, the size, and the item. Here we have healing abutments that are labeled, and once sterilized, they can be organized in these cabinets. Now here's the thing, some offices do not have these cabinets, and whoever places the most implants there is responsible for organizing. The most common sizes for implants are listed below for interior and posterior, premolar and molar, and corresponding healing abutment sizes. The torque specs that we need to use is 30 for regular, 20 for mini, and remember to use the prosthetic screw, not the lab screws. The lab screws are made out of softer titanium. Use the 1.2 millimeter hex driver to torque in the screws. Here we have a picture of implant sizes that are recommended. For instance, for a molar, you wouldn't place a 3.5 diameter for a molar because you have to consider the emergence profile and also the cantilever on the implant. When deciding on your implant diameter, consider the diameter of the cervix of the tooth. So for a molar, that the cervix is 8, you can use a larger implant like a 4.5 through 5 millimeter implant. The most common sizes for healing abutments are listed right here. You'll notice that the most common height size is 5 millimeters. The reason why is we take into consideration that with hyacinth, we place our implants subcrestal 1 millimeter, 3 millimeters for biological width, and 1 millimeter above the gum tissue. When we place our implants too deep, we're going to have trouble with the interference with the bone. When the bone interferes, you'll notice that when you put your healing abutment on, that you'll feel like a squeeze and a squeeze versus like a definitive stop. When that happens, you can use a bone profiler or simply a burr to remove the interfering bone. The hyacinth implants come pre-mounted and they have little indication marks that will help you with your surgery. The little dot right here will show you the direction when you're doing guided surgery. We're placing our implants 1 millimeter subcrestal, and this first marking will show you 1 millimeter below. If the gingiva is thin, then you'll place your implant deeper. This is the 2 millimeter marking. And then for flapless surgery, this is the 4 millimeter depth gauge, and you'll place this at the level of the gingival height. Then that way you'll have 3 millimeters of biological width and your implant 1 millimeter subcrestal. If you enjoyed this lecture and would like more information about implants, I recommend taking the master course Basics by Hyacinth. Talk to your rep, and there you'll learn more about suturing techniques, simple guided bone regeneration, and you'll place the implant on a live patient. More information can be found here and by talking to your rep. I took it myself and found it really helpful since Hyacinth has its own unique features. I hope you found this helpful with these tips and tricks. See you next time.